Aloha, and welcome to episode 19 of the Weekly Wellness Show. And thank you again for being here. And just as a quick one, just so I know that you're live, hit subscribe and continue keeping you well. Please hit the bell. All right, so let's get with it. So let's get to it. Oh boy, it's Monday, right? So anyways, today we're going to talk about cholesterol. All right, now, cholesterol historically has been something that a lot of people are concerned of. And it's something that, there's some concern, especially as we're getting older, okay? For years, we would think that, cholesterol equals health, meaning if your cholesterol is high, you are predisposed to some kind of heart disease, all right? Or possible heart attack, a stroke, you name it. However, we need cholesterol, okay? Our cholesterol can't get too low, but we don't want it too high. And there's a couple ways of looking at this, all right? So let's go back to testing, okay? When we get tested for cholesterol, we get tested usually for a few different things. One is your total cholesterol, right? And ideally, we want that number under 200, okay? Ideally. Over 200, when we start seeing things like 210, 215, 220, that's when doctors kind of get nervous, and then all of a sudden they want to write you a script to be on some kind of cholesterol medication or cholesterol-lowering drug. All right? So the other cholesterol we got to look at is your HDLs, otherwise known as a good cholesterol. And then your LDLs, which is the bad one. All right? That's the one that supposedly if we have too much of it, that's going to cause the artery to harden. It's going to cause a lot of other things to happen, and you're more predisposed to a problem. And then lastly, we also have to look at what is our ratios of total cholesterol to our good cholesterol. Do we want it high, low? I mean, where is that balance? And then also, what are the lipids looking like? What is the, for example, what does the fat in your bloodstream look like? Okay, and so we got all these things that we're trying to look at here and be serious about. However, there are some things that I have a whole new different way of looking at it. All right, now think about this. I want you to understand that your eyes are made out of cholesterol, okay? Your nerves are coated in cholesterol, all right? That's called myelin. We need cholesterol for the brain. The brain is 65% cholesterol. So I want you to keep in mind that, cholesterol drugs are not something we're supposed to be on for a long period of time. They're supposed to help us get to that point where our cholesterol is normal through healthy lifestyle. And then you should have the conversation with your doctor about, hey, look, I got my lifestyle in check. Let's get off of this, all right? Well, usually that's not the case. Usually, not only are you going to be on a cholesterol med, like a statin drug called like Lipitor or Crestor, okay? But it's also accompanied for someone with high blood pressure medication, okay? And, and you're on it for the rest of your life, okay? Even if you're taking a small dose, like maybe 10, 20 milligrams of it, no matter what, you are taking one of the two most toxic drugs in America today, all right? And remember, we live in a country where this country profits on people being sick, not being well. And you may be seeing that right now in the whole coronavirus stuff. There's a lot of people, the powers that be, that are making a lot of money in the last 3 to 4 months, and then some. So, but that's for another discussion. Let's take it back to cholesterol. So, here's an artery, okay? And this artery here, if you can kind of see it, it has like normal, and then some with fatty streaks, abnormal, and then like a blood clot. So this is what a normal artery should look like right here. And if you look at the inner walls, you see how smooth that artery is? It's like smooth like Teflon, right? You see those purple dots in there? Those are called your endothelial cells. Now the purpose of the endothelial cells is to release nitric oxide, all right? Now nitric oxide is a gas, all right? Not nitrous oxide that you would see in something in the Fast and the Furious. But nitric oxide, what it is, it's a gas that is released in the inner wall of your artery, allowing that artery to be slick or smooth like Teflon, okay? It allows the artery to expand and be flexible. So that way when the heart pumps, the heart's just pumping effortlessly, no problems at all. However, due to certain toxins or, what we call just any kind of possible disease or metabolic process, right? Or inflammation, you've heard that word before, the artery starts to get a little hard. Now, as you can see here, let me get a better picture for that. So you can see that little yellow plaquing in here, okay, on the bottom. You can see that things are now starting to stick to the inner wall, otherwise known as the inner wall is otherwise known as the endothelium. And now instead of the artery being smooth like Teflon, it's now starting to be more like Velcro. It's attracting particles to stick to it as the heart is pumping blood through the arteries. And what causes the artery to do, the artery is not as flexible. It starts to harden a little bit. So now the heart has to pump that much more than it used to, okay? Well, if we don't take care of that problem, and it's mostly lifestyle, or also just understanding the world of some of the food we're eating is, let's just say, more inflammatory than we want to be, especially sugar. Now remember, it's not fatty foods that cause this cholesterol. It's mostly things like your carbohydrates and the good carbs, the rice, the pasta, things with sugar. That is what creates this inflammatory response and creates bad cholesterol, okay? Otherwise known as inflammatory cholesterol. And I know your doctors aren't testing that. We're going to talk about that too. But let's say if things keep going on for years, all of a sudden, maybe we're putting on some weight, we don't feel as good. Well, guess what happens? That artery, as you can see here, starts getting even more clogged up. So as you can see, and maybe get this, here we go, this is a better view. As you can see, there's more, fatty tissue going on there. There's more what we call, just lipids. And this is now what we call an inflamed artery, okay? Now, look how much gunk is in there. Now the artery is really stiff. So when the heart pumps blood, it really has to push it into that artery now. Now it has to work. Oh, man, I got to get that blood in there. I got to get it in there because it's coming from the lungs and it has to go leave the heart and into the arteries, all right? So now look at the arteries. They're getting gunked up. They're not as clean. They're not as viable or plastic or flexible is what I'm looking for. And so now the heart has to work more. Lastly, this is what we call a blood clot, otherwise known as a heart attack. And only 30% of the people out there are lucky enough to talk about it. Okay? This is when the heart is working so hard. It's pumping, and then it's pumping so hard, it just gives out. And that's what we call myocardial infarction or a heart attack and possibly a stroke. Okay? So we never want to get here. This is bad. But sometimes, we can't depend on a cholesterol test to determine if that's the issue, if that issue is coming down or not. And here's why. When you have LDL, your HDL and LDL ratios, right, or HDL and total cholesterol ratio, all right, we want that low. We want that like under 3 or, as low as possible from a ratio standpoint, like under 3.0 or under at least 3.5, okay? There's another cholesterol called inflammatory cholesterol. Now, this is the cholesterol that does the damage. This is the cholesterol that sticks in the inner wall of the artery, and you could test for that. That stuff is the inflammatory stuff. You're only getting tested on the LDL, which is high or low, but a lot of times, some people just genetically have high cholesterol. My cholesterol is at 300, okay? Oh, wow, I should be watching that. Well, yeah, I do take caution, but remember, I also run my own labs, and I have labs that will tell me, what my liver's doing, am I producing good cholesterol, what my vitamin D is. I get my blood pressure checked regularly, very low, by the way. So that's telling you my heart is not pumping as hard as it should be, right? If my arteries and LDL were that high, okay? So, is it bad to have high LDL? I'd say no. It's not bad at all. Just some people are like that. And by the way, what's the number one thing that's happening in America right now that we're seeing? A huge spike in Alzheimer's, Parkinson's, and dementia, all right? What's the number one prescribed drug in this country? You got it, statin drugs. One of these statin drugs, they reduce cholesterol. What's our brain made out of? 65% cholesterol. Okay, you kind of see the correlation here, all right? So we just need healthier fats. We need to take better care of ourselves, to take care of the brain, to make sure the heart's working right, and also just make better choices. And also have someone to help guide you rather than your normal medical doctor. Your normal medical doctor doesn't have time to deal with you. They don't have time to give you the attention you need. You need someone like a functional medicine practitioner that will work with you, or a concierge doctor, okay? They're very popular now. Your insurance covers like the main stuff, in case of crisis, things like that. But with a concierge doctor, your insurance may cover a little bit of that, but you're going to pay a little bit more because you're getting more service, all right? And you're also getting another set of eyes on whatever your doctor is doing. I always believe in having oversight. We all love our doctors, but there's nothing wrong with getting another opinion just so you can learn something new about yourself that maybe you didn't know before, okay? Another great reference for you, if you really want to understand the world of cholesterol or cholesterol drugs, I highly recommend this book. It's called The Great Cholesterol Myth by Dr. Steven Sinatra. That's just like Sinatra, like Frank Sinatra. Steven is spelled Stephen. Dr. Steven Sinatra, The Great Cholesterol Myth. This is a very easy read for the layperson. You don't have to be a doctor or someone with a health education to read this. When you read this book, you will learn the entire world of cholesterol, why a statin drug, one of the most toxic drugs you can put in your body, and you're going to start asking yourself, why am I still taking this drug when I'm over 60, 65 years of age? And by the way, just so you know, this drug is not proven to be of any clinical value after the age of 65, and it hasn't been proven to be of value to females. Just letting you know that, okay? So, some things to consider. Oh, the other thing these statin drugs do too, they decrease the production of coenzyme Q10, all right? CoQ10 is an enzyme that energizes the powerhouse of your cell called the mitochondria, right? Well, think of three major engines in three organs in your body that require tons of energy. All right, let's get to it. One, the brain. It's always on, right? It needs energy. It needs fuel. Two, the lungs, because your liver, right? Your liver needs a lot of energy because it's constantly filtering out everything that you're eating and metabolizing it. And lastly, the one that needs the most energy, you got it, the heart. Think about what I just said. This is a drug that reduces energy that goes to the cells, the powerhouse of all your cells in your body, and where the most mitochondria is located, these powerhouses of the cell, the most mitochondria is located on the heart. So you tell me, are you taking something that's to lower the cholesterol, or that's actually depleting your heart of the necessary energy it needs to function? That's what I'm saying, okay? Read this. When you read this book, like I said, The Great Cholesterol Myth, you'll love it. I'm a big fan of Dr. Sinatra. He's also a, former cardiologist, former cardiovascular surgeon. You'll learn a lot from him. And if you enjoyed, and I really hope you enjoyed it. There's a lot of controversy on this. Is this for you? You just got to know your numbers. And unfortunately, the testing that your doctors are doing that you get maybe once a year, you're only getting a small piece of the picture. You're not getting the big piece. You're not seeing like, well, if my cholesterol is high, do I really have to be on a drug or a statin? It's up to your doctor, but I would definitely recommend you look for other testing. I like to test for a thing called creatine kinase to see if my muscles are breaking down, which is something a statin drug. The primary effect of any statin drug is the breakdown of muscle, okay? And to test that, you want to do, you run the creatine kinase enzymes. Another marker I like to test for inflammation is homocysteine. And what's the last one I want to do? Yeah, homocysteine. And there's a couple other ones out there too that you want to talk to your doctors about. There's so many different inflammatory markers. And if you just mention it to your doctor, chances are they're going to do it. So one, creatine kinase, because if you're on a statin drug, you want to make sure that your muscles aren't breaking down. That's very important. And then two, with that statin drug, if you're feeling any kind of muscle pain or cramping, that's an example of your muscles breaking down. You're like, God, why am I so sore? Why? I just feel like I'm atrophying. I'm not, where I am today. And then that's creatine kinase you want to test. And then homocysteine, which is another inflammatory marker. And the other one is C-reactive protein, high sensitivity, or the cardiac version. So I always recommend get the cardiac version. The cardiac version for C-reactive protein, CRP, okay? Get those three tests, homocysteine, C-reactive protein, cardiac version, and also creatine kinase. Get those three tests done with your blood work, especially if you're on a statin, and you'll really find out if you truly need to be on that drug or not. I hope you found this helpful. Thank you very much. Please, again, just so I know you're live, hit subscribe, and let's keep you well. Please hit that bell, and we look forward to seeing you next time. Mahalo.